Thank you, Divamalaji. Thank you, Hindi team. Now it is the time for the English session. We are moving to English session. Today is our 1535th day of continuous webinar. Before beginning the session, we will have a silent prayer. Good evening and welcome once again. Today is our 1535th day of continuous webinar. Today's our guest is Dr. Manish Bhatia. He is B.H.M.S, B.C.A, M.Sc, C.C.H, M.D. Homeopathy and founder director of homeopathy.com, leading homeopathy portal and founder of homeopathy book, Homeopathy for Everyone. And he is a professor of organon of medicine in Sosta Kalyan Homeopathic Medical College, Jaipur. And he has teaching experience of 20 years and member of advisory board of Homeopathy Link and director of Asha Homeopathy and author of lecture of organon and co-author of homeopathy and mental health care. He got many awards like Raja Pajwan Dev Award and Samuel Hahnemann Memorial Honor Award, Dr. APJ Abdul Kalam Award and Best Author Award. And we have to say many more about him. I shortened his profile to use him for his lectures. Anyway, I am inviting Dr. Manish Bhatia to our webinars. You are welcome, sir. Please. Sir, you are the co-host now. You can unmute yourself and start. Thank you, sir.
Thank you, Deepmala. Thank you, Dr. Dinesh, and everybody. Am I audible?
Yes, sir. You are audible.
So we had done this session on Sunday in Hindi, and thank you once again for having me with you. And let's start this session. I'll share my screen. So in this session, what we are going to do is we are going to study a case, a difficult case with very excellent results. And we'll delve deeper into what we can learn at different stages, what mistakes we can do while analyzing a case, while processing, while taking the case, while selecting the posology, and what is the role of understanding the rubrics, understanding the remedies through the repertory and through the provings. We are going to study all this just through one case, and we'll try to learn many lessons through a single case. So this was a case of anal fistula, and it was a post-surgical case. So this case, the story of this case was that this patient who used to live in Madhya Pradesh, in 2023, he develops fistula in anal, and he is recommended surgery. He gets surgery done in Madhya Pradesh, in his hometown. The surgery fails in the sense that the wound doesn't heal after surgery. The fistula wound doesn't heal after surgery. Then somebody tells him that he should come to a very famous surgeon in Jaipur, which is my city, and he should get it operated again. So this guy comes to Jaipur and gets a second surgery done. And after the second surgery also, the wound refuses to heal. So this patient comes to me in March 2024, this year itself, where his wound had not healed for the past 6 months. And the doctors were still not sure when it will heal. They were saying it could take 3, 4, 6 months more with daily dressing. So this was a very painful experience for this person. When this person came to me, he was like skin and bone. So let's go deeper into this case. So the first consultation of this case was in March 2024, 13th March 2024. As I said, that this person developed anal fistula. He was operated twice in October 2023 in Madhya Pradesh and then again in December 2023 in Jaipur. The wound was non-healing, daily dressing continuing. Surgeons saying may take 3-4 months of dressing for the wound to heal. And as I said, he was all skin and bone. So he had lost 28 kg weights in 6 months. 6 months, 28 kg weight loss. And he was like bare bones when he came to me. This was the state of his anus. You can see that it's all cut up and open. We'll do a video after this slide. The video is gross. Some of you might not like it, but as medical doctors, you should not be averse to it also. Why I'll be showing the video, because the video has some clues to it, and also with the video you'll be able to appreciate the painful process of dressing that this person was going through. So this is the state of his anus, cut up, not healing. And let's see the video of this person. This is the dressing video that this patient had shared. This was the second video. The first video of the same day, the first video that he brought to me, I've not shared here, because in that video his genitals were exposed, his testicles and penis were clearly visible, so I did not put that video up. But you can clearly see that how his anus is all cut up. And every day he had to go to the hospital. Every day the dressing used to be done like this with saline. First they would get enema, the bowels would be cleared, then they would put saline, then they would clean, then they would put antiseptics, then they would put gauze. And this is how dressing is done after fistula for most people. But for most people, the post-surgical wound heals in a couple of weeks. In this patient, the wound was not healing for 6 months. This is the video after 6 months. 2 surgeries, 6 months, and the wound not healing, gaping wound. I'll rush it through because there's just more and more dressing. But you can imagine somebody going through this process every single day for 6 months. How painful, how embarrassing it would be to undress in front of the medical staff every day, to get himself enema, to get himself cleaned. And then they would stuff gauze inside his rectum for the next 24 hours. So that the wound doesn't get infected. Every day this would be cleaned, and then this would be stuffed with medicated gauze. I'll show you how it is done later in this video itself. So once this is cleaned, sterilized, then they'll fill it with gauze. Now you can see that this is being filled with medicated gauze. And this would be kept like this for the next 24 hours. So if he had to pass stool, the gauze had to be removed. And that's why he stopped eating, because of the fear that he'll need to pass stool against. And that's why, you can see that it's all packed up. His rectum is all packed up. And this is what was done every day in OT. Painful process. And because he was not eating, out of concern that he might need to pass stool again, he lost 28 kg weight. Now, how do we approach this case? How do we even give a prognosis to this case? Do we even take up such a case or not? This case with 2 surgeries, 2 failed surgeries, wound not healing for 6 months, doctor saying still might not heal for another 4-6 months. What do you do with such a case? How do you handle such a case? So there are many approaches to deal with this case. First, we can think about remedies for anal fistula. Because this primary pathology was anal fistula, we can think of what remedies are there for anal fistula, and then we can try to figure out which of these remedies fits. And in complete repertory, there are 68 remedies for anal fistula. Some are very common, very popularly used. Basilinum is very well known. Berberis is very well known. Calcarea carp, Calcarea phos, causticum, silica, nitric acid. They are all very well known remedies which are often indicated. Graphitis, in cases of thuja, in cases of anal fistula. But we can look at this case from many different angles. For example, we can, instead of considering remedies for anal fistula, we can consider remedies for wounds. Ultimately, now this is not a fistula. It's a wound. It's a wound. And what kind of wound this is? This is a lacerated wound. It's a cut wound. So we can think of lacerated wound remedies, which are indicated for lacerated wounds like calendula, carbolic acid, hypericum, hamamelis, Staph aureus is there. We can consider one of these remedies depending upon the symptoms. What is the state, whether the margins are clear, whether the margins are black, whether it's bleeding, how painful it is. All these are considerations if we have to select a remedy based on the lacerated wound. But what else we can think of? Is there something more that we can look? We can also look at remedies for slow healing wounds. Obviously, this is a slow healing wound. It's refusing to heal since 6 months. So slow healing wounds, we have got 161 remedies. We can figure out if one of them is indicated. And then we have something very specific in our repertories, ailments after surgery. So we have got a rubric, ailments, surgery after, operations after, and within that also we have a sub-rubric, operations after, orifices at. So if you have a surgery on your nose, on your mouth, in your ears, your vagina, your anus, rectum, then you can, and then there is a complication, you can consider this rubric. Operations after, orifices at, and only 4 drugs, belladonna, colocynth, hypericum, and Staph aureus. So we might think about giving one of these remedies. Or we can think if there is a remedy which covers all the 4 symptoms that we have listed so far. So you can see that if we repertorize all these rubrics, lacerated wounds, wound slow healing, operations after, orifices at, and fistula, we see Staph aureus is there. Staph aureus is closely indicated, and if we remove this small rubric after orifice, we will see that even calendula covers well, graphitis covers well, and Nux vomica also covers well. So we can think of remedy like Staph aureus, calendula, graphitis, Nux vomica. One of these remedies might be useful in this case, but how do we move forward from here? Which remedy to give? Or should we give this remedy at all, one of these remedies at all? What more do we need to identify which remedy is indicated? What we need is the case history of the patient. We have still not shared the case history. So because we have not shared the case history, you should not jump to the conclusion what remedy might be required. Because the rubrics the 4 rubrics that we have discussed so far, they are all therapeutic rubrics. Therapeutic rubrics need not cover the remedy for that particular case. They have been added to that rubric because somebody took the case, somebody took all the symptoms in a particular case and cured that pathology. And because that pathology got cured with that similimum, that remedy was added into a therapeutic rubric also. And that is why you see for the same rubric, the number of remedies in boric would be less, in Fatak would be less, in BBCR would be less, in Mod Kent, there would be more remedies in the same rubric. clinical rubric. In complete repertory and synthesis repertory, there will be more remedies in the same rubric, and different versions of these repertories will also have more remedies in the same rubric. That means clinical rubrics or therapeutic rubrics are not should never be the sole consideration for selecting the remedy. So let's hear the history of this case. So what is the story behind this case? The occupation of this person was birthday decoration. So this young man in his 20s, what he used to do, he used to do party decoration, birthday party decoration, and different party decorations. So he had two different businesses. One, he would do the decoration himself, and another was that he would sell the stuff that is used for party decoration to other vendors also. So in 2023, what happened is that he lost some money. He lost a lot of money to other vendors to whom he used to supply the stuff for birthday party decoration or party decoration. They did not pay him back, and at that point, because of the excessive business worry that he developed, the fistula initially appeared. So the fistula initially appeared after he had this business worry because people did not pay him his money back. And later on, because of the fistula surgeries, he had to come to Jaipur. He was on bed rest. He had to go to the OT every day for the dressing. His business collapsed. Obviously, he could not go to attend to his business in this state. So when I asked him more about his business, I realized that he was very, very concerned about his business. Even when he was talking to me about his fistula, his primary concern was not why it is not healing. The why was not there. He was not even concerned about how long it is going to take to heal. He was not even concerned that I should heal him as soon as it is possible so that he can resume his normal life. His primary concern was, please fix me so that I can resume my business. So even in this state, why he wanted to get better? Because he wanted to do his business. So we see multiple areas. First, the business failure that he had, the problem in business that he had, that led to the initial fistula, and even constant dwelling on business. Even in the sick state, the whole idea was I should get well as soon as possible so that I'm able to resume my business. So I asked him more about his business, and something very strange came up. He was into the business of party decoration, birthday decoration. And when you're doing birthday decoration, you have to sometimes climb up to put balloons or to put different things up. He said, although I'm into the business of party decoration, I cannot climb on any ladder. I'm very afraid of heights. I'm very afraid of heights. So I have to ask somebody else to do the decoration for me. And this was something very peculiar. So look, now we are trying to find the individualizing characters of this case. We know the pathology. We now know the etiology also. This started because of business troubles. We are trying to find more individualizing symptoms. And one individualizing symptom became very strong individualizing symptom was that fear of heights is there. So then I asked him more about the state because this business state was very important for him. So I asked him what happened when he had this business failure. When people did not pay him back, what was his mental state like? He said, I get very angry when people don't pay me back. I get so angry, get so angry that I feel like I should kill myself or I should kill the other person. That is the kind of anger that I get at that point of time when somebody cheats me, somebody betrays me. Uh, I feel like I should kill that person or I should kill myself. I said, okay. And what happens after that? He said that anger soon subsides, and after that I feel very guilty. Why did I become so angry? It was not such a big thing for me to become so angry, so violently angry. at this point of time. So we come across another two more individualizing symptoms in case. One, he has violent anger. And the second thing is that after anger, there is quick repentance. Why did I get angry? So this was his story. Then I asked him more about his being. Uh, what is his daily routine like? What is his person? What kind of person he is like? And then he tells me that every day he gets up early in the morning at 4 a.m. For his puja part. For me, for a young mid 20s, 25, 26-year-old man, to get up at 4 a.m. For puja and something other rituals was a bit strong. So I asked him, please tell me more about it. And he says that he follows a guru in his city. So at 4 a.m., he would get up in the morning, he will take a shower, he'll go to the ashram, he'll do some seva, and he'll do puja part there for a couple of hours, and then he'll come back home, then he'll have his breakfast, and then he'll go to his business. So this is a very, very strong state where this person has been doing it for many, many years already. We know that this person has very strong religious inclination, religious bent, because it's not easy for somebody in his early 20s to be so committed, so religious that every day, every morning, he'll get up at 4 and take a shower, go to the ashram and do his seva, do his puja part for several hours, and then he'll come back. So we know that our remedy should have this essence also. This side of his personality also should be covered. The fear of height should be there. The violent anger should be there. The quick repentance after anger should be there. But also the religious nature that he has, that should also be there. Some more symptoms that I got during the case taking were that he used to get frightful dreams. And in the dreams, he used to feel that somebody has grabbed him and he used to wake up frightened. He was not a very social person. Uh, he was in the habit of drinking lukewarm water in the morning before passing stool, and he used to get perspiration on forehead, and there was desire for sweets. So there were some generals. When we take the case history, we ask everything, but the essence was, we know that this person developed problems after a business issue. We know that this person has a lot of focus on the business. He continuously talks about business, so he wants to get better so that he can resume his business. We know that this person has fear of heights. We know that this person has violent anger. We know that this person has quick repentance after anger. And we know this person is very religious. Now let's see what remedies cover these symptoms. So we have this one rubric, cares, worries, full of business about. So when we think about business problems, the first remedy that comes to our mind is bryonia. Bryonia is usually considered the first remedy because it's in the rubric talks business about. And especially when somebody is very business minded, is constantly talking about business or worried about business, we all often think about bryonia as a remedy. But here you see that the remedies are very different. Hyoscyamus, Nux vomica, Ambragresia, Calcarea carbonica, causticum, coca, Gelsemium, Calibromatum, Sepia, Zincum, Argimonia, Latrodectus, Lycopodium, Natrum, Muriaticum, Uranium, Metallicum. A lot of remedies will not be able to understand why they are present in this particular rubric. Why this remedy? Nux vomica, you can understand. Nux vomica is a very ambitious person. So we can understand why he might have anxiety about business. But why Ambragresia? Ambragresia is the super shy remedy that we have. Why Calcarea carb has anxiety about business? Why even Gelsemium? What is the business of sepia that she is worried about? So this kind of differentiation is very important to understand. If you don't understand why this particular remedy is there in this rubric, you'll not be able to understand the essence of that remedy. So let's see why hyoscyamus is there. Hyoscyamus is there in this rubric because In the proving symptom of Alzheimer's is unconsciousness, stupor, does not reply to questions, makes irrelevant answers, confusion, memory weakened, stupid, does not know where he is, delirium, talks of his business, scolds, indistinct, muttering loquacity, makes no complaints, ridiculous gestures and actions, loud talking, foolish laughter, deep depression of spirits. So you see, what is the proving symptom of Alzheimer's, because of which the Alzheimer's is there in this rubric, mind cares, worries, full of. Delirium, talks of his business. That means even when the person is not in his senses, he talks about his business. And that is why Alzheimer's is present in this rubric. We have another rubric, similar rubric, like mind business talks about. Again, you see bryonia is number 1 here. But Alzheimer's is also there, Rustox is also there, arsenic album is also there. This rubric is much more understandable. A lot of remedies which are ambitious, which are industrious, which are money-minded, that are present in this rubric. So you can take either of the rubric, but that rubric is more important because he was not talking about business, he was more concerned about his business. So let's take the couple of rubrics that I just mentioned and repertorize. So I can repertorize all the symptoms that I've spoken about, but in my clinical practice, because we all have busy practices, what I usually do is I just take a couple of very strong symptoms that I know that my remedy should have. And the remedies that come up from the repertorization chart, I quickly scan and I'm able to figure out which remedy the patient will need. So in this case, I just repertorized 3 symptoms: fear of high places, anger violent, and remorse, repentance quick. You see that there are only 2 remedies, sulfur and hyoscyamus, which cover these symptoms. So my remedy should be between one of these 2. Now, which of these should be either sulfur or hyoscyamus? Let's try to differentiate between them. What other was there in other symptoms were in this case? There was religious affections, lot of religious mania. You can use the word, but it's not mania per se, but religious affections, because when the person is very religiously inclined, we use this rubric. It doesn't mean that the person is in mania. So you see in this case also, hyoscyamus is there, sulfur is also there. Both the remedies are present. So how do you choose? We can't choose based on this rubric, but we know that both the remedies are still indicated. Now, in this case, what I did was I remembered the first thing that this person did. What this person did when he came to my clinic was he immediately said, he brought out his phone, "Sir, see this video." Even before telling me what his problem was, even before telling me that he had fistula, even before telling me that he has had this surgery done, he started showing me a video. And what was the video? This was not the video, very similar video, but that in that video, his testicles and penis were visible. He was not even trying to hide them. And this was like very, very shocking for me, because most people, when I get patients with suffering from fissures or fistula or genital warts, they're hesitant to uncover, undress, even when we have to counsel them that it's sometimes necessary to examine. But here this patient was, "No, sir, first see my video." And what video he's showing me, in which his genitals were clearly visible. For me, this was shameless exposure. So I get to the rubric, mind shameless exposes the person. And in this rubric, we have hyoscyamus niger, but we do not have sulfur. So I now know that the remedy that I have to give to this patient is hyoscyamus and not sulfur. We can differentiate on many other points, but I'm just telling you the core points that were important in this case to figure out the remedy. Now, there is a rubric, mind shameless, and there is a sub-rubric, mind shameless exposes the person. So this was exposure of the, exposes the person means you are exposing your private parts. So this rubric I took, and now I knew that this is this remedy that this patient needs, one, hyoscyamus, but we also need to differentiate between hyoscyamus, phosphorus, phytolecca, cicale cord, tarantula, bangarus, stramonium, veratrum alb. I'll be sharing some more information about these remedies so that you know how we have to understand the essence or the soul of the remedy, why a particular remedy is present in a particular rubric. How do we differentiate between very similar remedies given in a rubric? So this is what I do on 13th of March or March. When he came to me, 13th March, when he came to me, Hyoscyamus 30C 4 times a day in water doses. Now, you can ask me, sir, why 30C and why water doses? Why 4 times a day? Legit questions. So, Hahnemann upgraded his posology in 4th edition and 5th edition and 6th edition of Organon of Medicine. In 4th edition of Organon of Medicine, Hahnemann's posology was dry dose, wait and watch. And how long he used to wait, sometimes for 30 days, 45 days, 60 days, 90 days. And he didn't like to wait. He didn't like to wait because the highest ideal of cure is rapid, gentle, and permanent restoration of health, as given in the second aphorism of Organon. So for him, if he had to wait for 80, 90 days, 70, 90 days after giving a single dose, that means the cure was not rapid enough. And he wanted the cure to be rapid enough. So what he did was, he devised a methodology in which he could give the centesimal potency frequently, that is in divided water doses. And this is the posology of the 5th edition of Organon of Medicine. And in the 6th edition of Organon of Medicine, he gave the posology of 50 millisiemal scale. So why 30C? Because when we have gross pathology, we usually start with lower potencies. When we have to repeat frequently, we usually start with lower potencies. And why frequent repetition? Because the wound was getting manipulated every day. We needed more stimulus for it to heal. Usually water remedies, water divided doses, because this is a single dose being divided into multiple doses. You can repeat more frequently. So first prescription on 13th March 2024 was Hyoscyamus 30. He comes back in 2 weeks. 27th March 2024, he comes back. The good news is that after losing weight for 6 months, he gained 1 kg in these 2 weeks. Excellent prognostic sign. Somebody who was losing constantly weight, and now within 2 weeks, he has gained 1 kg weight. He was mentally feeling better, and he said that the fistula opening is now narrowing. Because the wound has not healed yet, my prescription was still the same. I continued the remedy, Hyoscyamus 30 4 times a day in divided doses, and for another 2 weeks. So another 2 weeks, the second follow-up of the patient was on 10th April 24. So how long it took? Nearly 28 days. 13th March 2024 to 10th April 24, fistula wound healed. How it healed? Look at this. This is the photo of 10th of April. You can see there is no cut here. The cut has healed with bare scarring, very little scarring, no wound left. So this is the magic of right homeopathy, the similimum homeopathy. The similimum, we say now, the similimum is magical. So from this state, and 6 months, 2 surgeries, 6 months of daily dressing, non-healing wound, we can come to this state in only 4 weeks, as little as 4 weeks, only 28 days it took. Now, and Hyoscyamus is not even listed in the wounds, in the slow healing wounds, in surgery, after surgery, in orifices, even in anal fistula. It's not mentioned. That is why it is important to individualize the case. That is why it is important that you understand the story of the patient. That is why it is said in homeopathy that you have to treat not the disease, but the person who has the disease. You treat the disease in isolation, you will not be able to produce magical cures. You can still palliate. You can still palliate. But palliation is not what we want. In some cases where the vital force is very good of this patient, you might see natural spontaneous recovery also, and you can say that my remedy cured. But the radical cures only happen when you are able to find the right similimum of the case. That is the whole magic. So let's look at some of the remedies. So if you look at the shameless remedies, the mind shameless rubric, there are 39 remedies in this rubric. Now it's going to take me very, very long, probably a full day to differentiate these 39 remedies. So we'll come to the lesser rubric. The rubric shameless exposes the person. We'll learn to differentiate the 8 remedies given in the sub-rubric shameless exposes the person. So the first remedy there was hyoscyamus. Why is hyoscyamus here? Hyoscyamus is here because the rubric, the symptom is indecent, not incident exposure, but indecent exposure, which may be active or passive in delirium, resulting from depravity or some strange mental quirk. This is the symptom. And what are the symptoms from Hahnemann's proving? Hahnemann ki proving may the symptoms given by the prover number 1, he strips himself naked. He lies naked in bed and chatters. Second prover gave the symptom naked and enveloped in a fur cloak. He senselessly wanders about to a great distance in the summer heat. And this rubric, this symptom 545 given in the proving is pure gold. Ridiculously solemn X in improper clothing. In a priest's cassock, put on over nothing but a shirt and in fur boots. He wishes to go to church in order to preach and perform clerical offices there, and furiously attacks those who try to prevent him, mixed with fury. So you see this one symptom in the proving, how beautifully it brings out the whole state of hyoscyamus. Shamelessness. Then he wishes to go to church in order to preach and perform. That is religious mania. And furiously attacks those who try to prevent him. That is violent anger. So one proving symptom from one prover gives you the whole gist, the essence of what hyoscyamus is about. And these are the symptoms in the proving because of which hyoscyamus is considered a shameless remedy. These are the symptoms because of which hyoscyamus is in the rubric shameless exposes the person. What is the second rubric in this remedy in this rubric? The second remedy is phosphorus. Now, what is the patient phosphorus like? Delirium, loquacious, violent at first, alternating with intervals of consciousness, afterward interrupted, erotic with indications of great excitement of sexual system, sexual dreams and violent sexual excitement. The proving shows a polarity of excitability and ecstasy with lowered inhibitions followed by indifference, stupor, and exhaustion. The phosphorus patient is pleasant, sympathetic, of sanguine temperament, changeable disposition or quarrelsome and easily angered, craving company, loquacious, amative, easily enthused but unreliable, without perseverance, impressionable, and very susceptible to external influences. An extreme loss of moral inhibitions resulting in the ascendance of the most animalistic impulses. Lasciviousness uncovers his person, seeks to gratify his sex instincts no matter on whom. Erotic mania, sex excitement, and shamelessness. So why is phosphorus given in this rubric? Shamelessness exposes the person because of the excessive sexual excitement. Look, hyoscyamus is exposing in a state of delirium. Phosphorus is exposing wants because she wants coition. She has lost moral inhibitions. She is so sexually excited that she has lost moral inhibitions. And she doesn't mind to show off herself, expose herself, to gratify herself. And that is why phosphorus is given in this rubric. Then we have the third remedy in this rubric, phytoleca. Great loss of phytoleca rubric is great loss of personal delicacy. There appeared to be total disregard of all surroundings, objects, and no disposition to adjust their persons under any circumstances. Sense of entire indifference to life and disgust for the business of the day. So, phytoleca is present in the only remedy present in the rubric delicacy, loss of personal, and is also present in the rubric indifference, appearance about personal. So what is the story of phytoleca? Phytoleca is very, in some relations, similar to sepia, that the patient is in an indifferent state, and how she is not just indifferent to others, she is indifferent to her own appearance. And that is why it is said delicacy, loss of personal. So if she doesn't, if she is not covering herself, if a blouse falls on her shoulder or if a skirt is pulled up, she'll not bother to cover up. Not bother to cover up because she's in an indifferent state. It doesn't matter to her what getting exposed or how other people are looking at her or how other people are perceiving her. She's in that state. Total indifference to life. And that is why phytoleka is there in this rubric. Phytoleka, shamelessness, exposes the person. So look, one remedy, delirium, is exposing in delirium. Phosphorus, exposing because of sexual excitement. Phytoleka, exposing because she's indifferent to her exposure. What else? Cecale core is there. Cecale core, you know the remedy Cecale core is a hemorrhagic remedy. And what kind of hemorrhage? Usually postpartum hemorrhage. So Cecale core is present in the rubrics delirium erotic, naked wants to be in delirium, delirium uterine hemorrhage with, and it is not present in lasciviousness. That means Cecale core is not sexually excitement, not exposing because of sexual excitement. Why it is exposing? What happens in Cecale core is that Cecale core, if you remember, it has a lot of heat and burning also. So when this lady goes into postpartum hemorrhage, because of the excessive hemorrhage, the lady goes into a state of delirium. And in that state of delirium, she gets a lot of sense of heat in the body and in the genitals also, and she uncovers because of the excitement and the heat that she's experiencing in that state. And that is why Cecale core is present in this rubric. So now you know that the Cecale core is also there, but entirely different reason, entirely different indication and picture for Cecale core. Then we have Tarantula hispanica in this rubric. Tarantula ludicrous and lascivious hysteria in a woman of 29 years. The patient had to be restrained by force. Excitement of the sexual appetite, constant sexual excitement with which nothing can control. Suffering of the prostate, debilitating sweats, unconquerable sadness and stupidity, eroticism, constant sexual excitement in a virtuous man, followed by hypochondriasis and unhappy mood. Lasciviousness in a man 35 years old, reaching almost to insanity. The sexual desire was so manifest in this woman that when playing or dancing with gentlemen, she hugged them before everybody. The just remarks on her conduct made her irritable. She cried with anger and finished by promising not to do it again. However, she did not keep her promise long. So what is Tarantula? Tarantula is known for dancing. And here also, the dancing is coming up in this rubric. So the Tarantula woman, because she is sexually excited, when she is dancing, she clings very, very strongly to her male partner. And so strongly, she feels him, she touches him, that it's a shameless exposure. So in Tarantula, you will find in males also, in females also. In males, it is often indicated when they have prostate enlargement, excessive sexual excitement with prostate enlargement. Tarantula is one of the remedies. So in Tarantula, you see there is a female again which is sexually excited, and she is not concerned about, she is not able to, I'm not saying she is not concerned, she is not even in control of what other people think or not. When she touches this person, she becomes shameless in her behavior. In her conduct, she becomes shameless. The way she touches the other partner, the way she touches, make her, the other person touch her, that is the shamelessness of Tarantula. That is the sexual craving of Tarantula. Of course, Tarantula has a lot of other symptoms. We cannot go, when we are prescribing Tarantula, we would like to see all those other symptoms also. Not just one symptom, but we are today just trying to understand the remedy based on one symptom. Then Bangarus is the one remedy. So Bangarus is a snake remedy which was proved by Farooq Master. Bangarus is present in the rubric dreams nakedness about exposing herself mame. Dreams seduction of exposing thighs and mame by. So Bangarus doesn't expose herself. Unlike Helleborus, unlike Cicale core, unlike Phosphorus, unlike Tarantula, Bangarus is not exposing herself. She is just getting the dreams that she is exposing. And that is why Bangarus is present in the rubric. Shamelessness exposes the person. It's a snake remedy. Then we have stramonium. Stramonium we know is a remedy with lot of lasciviousness, lot of mania, lot of fear. In stramonium, we have erotic delirium, sexual excitement, and naked wants to be. So stramonium primarily has lot of erotic delirium, excessive, you see loquacity is there, lasciviousness there. Even the speech of stramonium. What is the difference between tarantula and stramonium in this case? Stramonium will not just behave uh, erotically, stramonium will speak erotic. Stramonium will speak cheap. Stramonium will be lewd. And that is how you identify the stramonium. Of course, stramonium will have a lot of fears. Without fears, it's very difficult to have a stramonium. But and stramonium also has religious mania. But the difference between stramonium and hyoscyamus is that unlike hyoscyamus, stramonium is in his senses. He knows what he is doing. Hyoscyamus doesn't even know what he is doing. Stramonium knows what he is doing, and it's visible not just in his physical behavior, it's present in his speech also. Then veratrum album. Veratrum album is again a mania remedy. Just like hyoscyamus and stramonium, they are from one family, Solanaceae. Veratrum album is also a similar remedy, but it's in a state of mania. Veratrum album has the mania to cut and tear her clothes. So in the state of mania, she'll kiss everybody who comes near her. She'll tear her clothes and exposing her person. She has the religious mania also. She's lured also. There is excessive nymphomania also. And with nymphomania, there is violence and destructiveness. There is loquacity. There is great desire for sexual intercourse. There is void of shame, obscenity. And this is such a strong state. Unlike phosphorus, this state is so strong that the patient can actually go into convulsions. Because we know, like belladonna, veratrum album has a lot of cerebral congestion. There is so that there is so much violence in veratrum album that this person in the state of mania, in the state of shamelessness, has to be constrained. So you see, only 8 remedies given in this rubric, but all of them have a different picture. All of them have a different understanding. So if you understand these 8 remedies, you know which remedy to give in a particular case. So this was a very brief description of this case and some discussion of the remedies that were there in this rubric. The one thing that we need to understand is that what is written in the 6th aphorism of Organon of Medicine, that the homeopath needs freedom from prejudice. If I were prejudiced towards a certain remedy, say Calcarea fos or Barbaris vulgaris, towards all cases of fistula, this is my first line of treatment, I could have never treated this man. If I were prejudiced towards bryonia, ailments from business worries, or even Calcarea florata, I would not have been able to prescribe the right remedy to this person. So you will not be able to select the similimum unless and until you are able to get rid of your prejudices. Every therapeutic prescription that you do is actually strengthening your prejudices. Even if you are starting the case with the idea that you have to start with the therapeutic rubric, make sure that the remedy you are giving also covers the individuality of this person. Only then you will get the miracle cures that homeopathy is known for. Otherwise, you will get relief in many cases, but you will not be able to see the radical, rapid, gentle, permanent cures that homeopathy can promise. So with these words, I think my time is up. I would like to thank all of you for listening to me. I would love to get your feedback also. If you have any feedback, please post in the chat so that I know what you are able to learn. If you have any questions, you are more than welcome to post also.
Thank you so much, sir. It was excellent presentation, and even the accuracy of selecting medicine is wonderful. Actually, here from this session, we can understand that where the homeopaths fails, homeopathy never fails, but the homeopath fails because while I don't think every homeopath will go and this they don't show this accuracy in selecting remedies. Anyway, you have many appreciation in the chat box, and if anyone have questions, please ask questions to Dr. Manish Bhatia. We have 8 more minutes, so participants, please raise your hand and ask question, please. Vamshi, Dr. Vamshi, you can unmute yourself and ask question, please.
Yeah, good evening, doctor. That has been a wonderful session, and we really had the fine differences between these medicines, these remedies, was really depicted excellently. I just wanted to know, is Dr. Manish sir going to take a session every day? Is it an everyday session, or is it like once a week?
So this is IFPH platform. I'm taking a session after 1 year.
Oh, is it? I would really recommend you, doctor, to please take a session at least for 15 days. It really makes us to read more about it. Your pointers are really enlightening because we would explore further. You've just left the spark. The fire is built in us, so we're going to build on top of it. So it's really, really educating, as well as finer points is what I think, because of your experience and your practical experience, you have known a lot which we may not have experienced till date. So it would really help if you can share your wonderful experiences of the miraculous cure of homeopathy, because it's a wonderful drug, and it's a blessing of Hanuman. We are all blessed to have this medicine in our lives and all that stuff.
So
Exactly.
I'll be there as and when I'm invited to this platform.
Okay.
That's all I can say.
Okay. Thank you, doctor. Thank you so much.
Dr. Danish.
Good evening, Dr. Manish Bhatia. It's really an excellent session, and how beautifully you come up with the case and how you are able to solve the case in 28 days. That was really uh, impossible as far as the other systems are concerned. They have tried twice with the surgery, but the patient is still struggling. But as a homeopath, you look in a different angle. I must say that your selection of the remedy also was exactly a simillimum. That is what why he got the result in the shortest time also. Unfortunately, most people believe that since it being a local malady, you have to treat in that sense, but it is not the way you looked into the case, and you really entered into the patient and to find what are the reasons, how he talk, and what are the things there in him. And that's why you got such symptoms and the talk of business and everything, as you narrated, how differentiate, how you really differentiated the bryonia, hyoscyamus, sulfur, and all those remedy in a beautiful way also. And even for example, even if the patient have a migraine, your selection will be the same medicine. That is what is homeopathy.
Yes,
Am I right, sir?
absolutely.
Whether he come up with some peptic ulcer.
Absolutely. If the core symptoms of the patient, if this patient
Yes.
developed migraine after business failure and had the same symptoms, I would have still given hyoscyamus.
Yes,
It,
whatever
it
may
doesn't matter which end of the body is affected.
Exactly. That is why the totality is taken into consideration, and not only your depth of knowledge in materia medica really save you in choosing
Yeah,
the right remedy in short time also. But it is just like
I would like to interject here. Look, I am a teacher of organon. I've taught organon all my life. I'm an associate professor of organon. I have written books on organon, and that is what I do. I don't consider materia medica my strong point.
Yeah, that is reason.
If one know the basic of homeopathy, naturally the materia medica will come on the way.
Yeah,
And
it will come up, but some
Yeah.
people have like encyclopedic knowledge of materia medica. I don't have that knowledge, but I make sure that I refer to materia medica when I have to choose a remedy. There are no shortcuts in remedy selection. If I'm not sure why a particular remedy is present in a particular rubric, I'll open the proving and I'll try to understand the essence of that remedy before actually giving it.
That's what exactly every homeopath has to do. When you get medicine after repertorization, it is your duty to make sure that the medicine is the right one. So then only it will work for the patient. So in order that you will have to refer your materia medica text and make confirm that these are the things that are there. But of course, there will not be a sentence like that. ISMS is a good remedy for this particular fistula. That is the basic difference between the materia medica study and the general study. Am I right?
Yes.
While he's explaining the symptoms and all, I was listening like I'm watching a movie which is going to select like a suspense.
Exactly. It was just like a movie storytelling.
Yeah.
And really, you are the right person who can deliver in that way.
Yeah,
That's why some of the
it's a
students
wonderful session, and it's
we
light and dust and many I don't know how to say. It was wonderful.
Thank you so much.
so that everybody will because we are uploading the videos of the same on the very next day itself, so that the purpose of International Forum for Promoting Homeopathy is to take homeopathy to every home. So this kind of research work is this will be one of the research this can be considered as a research work rather than simply teaching.
True.
Congratulations, sir.
Thank you.
And anyone else? Dr. Danesh?
Yes, yes,
Uh,
as I have talked,
Alvin?
it's time already.
Yeah. Now we are winding up the English session and moving to Malayalam session. Thank you, Dr. Bhatia, for your excellent presentation. Come again. And I'm inviting Dr. P. Shaila for moderating Malayalam session. Doctor, you're